The OBIX Perinatal Data Systems exclusive e-tools were developed in collaboration with well-known EFM educator Lisa Miller, designed to provide care providers with the ability to get fast, accurate assistance in the assessment of fetal heart rate baseline, variability, accelerations, and decelerations. E-tools allow clinicians to apply NICHD definitions with confidence and clarity. The e-tools can improve clinical practices, educate staff, and promote patient safety in electronic fetal monitoring. Now, to tell you a bit more about the use of e-tools, here is Lisa Miller.
Hi, I'm Lisa Miller. I worked with OBIX to develop e-tools. Based on my EFM ruler for paper strips, e-tools allow clinicians to apply guides directly on screen to help correctly interpret and identify based on the NICHD nomenclature. Let's have a look at the tools. Baseline tool. The baseline tool is a horizontal red line that is placed over the fetal heart rate tracing to help clinicians determine baseline to the nearest 5-beat mean per the NICHD guidelines. The baseline tool is hovered over visually identifiable baseline, allowing clinicians to choose the appropriate baseline mean. In this example, the fetal heart rate is 120 beats per minute. Variability tool. There are two types of variability tools designed to help clinicians differentiate between minimal, moderate, and marked variability. The 5-beat tool is a horizontal magenta-shaped box that measures 1 minute in length and 5 beats per minute in height. The box should be hovered over 1-minute segments of baseline to see if the variability of the baseline can be encompassed by the box. If so, the variability is read as minimal. If the variability exceeds the 5-beat box for the majority of the baseline, the variability is greater than minimal, and the clinician should use the 25 beat per minute tool as the next step to determine whether variability is moderate or marked. If the variability is greater than 5 beats, the clinician can apply the 25 beat variability tool. The 25 beat variability tool also measures 1 minute in length, but the height is equivalent to 25 beats. If the fetal heart rate variability exceeds 5 beats, but fits within the 25 beat tool when hovered over the baseline, baseline variability is moderate. Should the fetal heart rate variability exceed the 25 beat box for the majority of the baseline, it would be considered marked variability per NICHD guidelines. Acceleration tool. The acceleration tool is composed of a horizontal red line with an equilateral triangle measuring 15 beats per minute at its peak and 15 seconds from onset to offset, consistent with the minimum requirement set by the NICHD for accelerations in gestations 32 weeks or greater. Once baseline is established, the Accel tool slides across the baseline, and the triangle can confirm the presence of fetal heart rate accelerations. It can be used intrapartally or antepartally, and a 10 by 10 tool is available for use with gestations of less than 32 weeks. Deceleration tool. The deceleration tool consists of a horizontal magenta line, 30 seconds in length, with a white X at the beginning and a long vertical magenta line at the end. By placing the white X at the onset of a deceleration and comparing the deceleration's nadir to the vertical line, clinicians can determine whether the deceleration has an abrupt, or less than 30-second onset, versus a gradual, or greater than 30-second onset. Determining the onset to nadir of a deceleration helps clinicians differentiate between types of decelerations. Additionally, the vertical line of the deceleration tool assists clinicians in comparing the onset, nadir, and offset of the deceleration with the onset, peak, and offset of a contraction. I hope these brief explanations have provided you with an idea of how e-tools can enhance and improve your ability to apply the NICHD definitions at the bedside. As an educator, I'm committed to helping clinicians work smarter, not harder. Thank you, and all the best in your practice.